Hi, Colleen Kupka here. I am with Rejuvenate Hormone and Weight Loss, and I wanted to come and talk to you today about perimenopause. I get a lot of women that are coming in with so many different symptoms and not knowing what to do. As of recent, I was reading a clinical paper which they surveyed women, and what was found is that so many women, their providers, were not talking about perimenopause or preparing women, as they get to it and also as they get to menopause. It can be such a confusing time of your life. So some of the symptoms that can occur: brain fog, tired, just not interested in things, weight gain, libido lost or diminished quite a bit, not being able to sleep at night, anxiety. Our periods can fluctuate to where we have a period, then all of a sudden it's gone, or we have a period and then there's just a light scant one, or you don't see it for a month or two and now you think you're pregnant. Not usually, but it can happen, so we have to be careful during this time. So, you know what? There's just so much that we can do to help during this time. So, what are the things that I tell my women? First off, diet, lifestyle, getting to that gym, just really starting to take care of ourselves as we age, right? Also, next thing, medications such as, or hormones, such as progesterone. Progesterone is a lovely, lovely drug or hormone. I keep calling it a drug, it's a hormone drug. But at any rate, it is not progestin. Our bodies have always made it. So what is it good for? Well, it can help us sleep at night, where a lot of women are having difficulty in sleeping during this period of time. It can also calm our minds, help with our mood fluctuations. It is also breast protective. Some of my women, I had one lately, she was telling me that when she drives over a certain bridge, she just gets real anxious. And she has found that the RDTs, that's what they're called, really help with that. Also, progesterone oral capsule is what I firmly believe in. And the progesterone creams, a lot of people will order them, and I don't know why. Because really, you can't get to optimal levels. The other thing that I really like to do is use compounded, if at all possible. It's better grade progesterone. What's the other thing that we can do? Testosterone. Testosterone, again, we've made it our whole lives. And so what does it help with? Well, it can help with visceral fat. It can help your energy, your endurance, your libido. There's just so much heart protective that it can do for us. The one thing I do not recommend at this time is taking on additional estradiol. And I see that out there, that there are some prescribers recommending it. Well, this is the problem. When we're in perimenopause, one day our estradiol will be low, and the next day it will be high. It's something that really, why measure? Because it's going to change from day to day. The problem is that when it's already high and we're putting more into the tank, it can really mess with our mood, cause anger, and so many different things like that. And the thing is also it can cause endometrial thickening, which can increase our risk for endometrial cancer, breast cancer. So during this time, stay away from the estradiol. How long can this all last? Up to 10 years. So when do you know that you're in menopause? Is when you haven't had a period for a year. So there is, ladies, so much that you can do, and to make this simpler and to actually prepare yourself as you age, right? So if you're looking for a provider that truly cares, because when I went into perimenopause, let me tell you, I didn't get much help, and it was really a confusing time in my life. I'm a concierge nurse practitioner, so I work one-on-one with my patients. They have constant contact with me. You're not sitting in a waiting room. You are always available to text me, call me, as I think that this is a real journey and that women need somebody that understands alongside them. So if you'd like a consult, give me a call. I pick up my own phone, 480-589-3999. Check out my website, www.rejuvenatemyhormones.com. And I also have a podcast, Rejuvenate Your Hormones and Wellness. So I hope this information has helped you. Cheers to rejuvenating your hormones, getting through perimenopause without a lot of issues. Take care now. Have a good day.